The three fire authorities, North Wales, Mid and West Wales and South Wales, are the accountable bodies for the fire service throughout Wales. Fire authorities are responsible for keeping communities, businesses and the environment in Wales safe from fires and other hazards as effectively and efficiently as possible. Everyone is familiar with their role as a 999 emergency response service, but in recent years a key part of the role has been preventative, with more focus on education and home safety checks. This approach has led to a reduction in the number of call-outs to fires and contributed to a safer place for the people of Wales to live and work in. Whilst fire call-outs have reduced, the service is expected to respond to a wider range of incidents, like flooding and road traffic accidents. With this in mind, fire authorities have had to adapt to ensure they have the right skill set available to deal with these ever-changing risks. Alongside this, they have worked to diversify the workforce to ensure they reflect the diverse communities they serve. With years of austerity, fire authorities have had to work more efficiently. This has led to a more risk-based, data-driven approach, ensuring prevention work is targeted to areas of greater risk, like focusing on areas with high levels of deprivation, antisocial behaviour, high-risk homes and buildings, and vulnerable people who are more likely to have a fire incident in their homes. Like national parks, each fire authority is a freestanding local government body comprised of councillors drawn from local authorities in its operating area. Fire authorities collaborate through various forums, including the National Fire Chiefs Council and the Joint Emergency Services Group. As an emergency response service, fire authorities were well placed to implement crisis response plans once the pandemic hit. The pandemic created opportunities to collaborate with blue light partners, taking pressure off ambulance crews that were under immense pressure. But it also created difficulties in the way crews had to limit contact with each other and the public. Training, development and recruitment were further challenges that needed to be overcome. We have spoken with two officers who have been at the forefront of these challenges. Richard Fairhead, Assistant Chief Fire Officer for North Wales Fire and Rescue Authority, and Sally Chapman, Deputy Chief Officer, Director of Corporate Services for South Wales Fire and Rescue Authority, to get their views on the last 12 months. We started by asking them what impact COVID-19 had on the authority.
When the pandemic started in the UK, and well before the first lockdown, we were running gold meetings because we could see that this was going to be something which was potentially going to test us as an authority. And probably about 2 weeks before the national lockdown was announced, we made a decision within service that we would look at ensuring that we set a strategic intent, which was to keep staff safe and maintain our services to the communities. So we made a decision good 2 weeks before the national lockdown to basically insist everyone worked from home where they could, and set up lots of other processes to allow that to happen. Clearly, we couldn't have firefighters not working from the fire station, so we had to put measures in around that fire station and how we kept them as safe as possible. And that was an ongoing program. As we learned more about the virus and as we learned more about things, extra control measures were put in place. But we very, very early on, our fire stations, we enforced the 2-meter rule. We enforced correct PPE. They have FFP3 respirators, which they had to wear at all times, unless they were, when they were 2 meters within 2 meters of each other. But on a fire station, we were able to say, if you stay 2 meters, you don't need to use that. We changed the start and finish it processes, so nobody actually crossed each other on the way into a station. They went in one way, they then went out the other way, and a new watch went in, so there wasn't that mixing of watches. And what we did is we run a system where we have red watch, blue watch, green watch and white watch across the service area. So the same red watch work at the same day and the same times across our stations. So we bubbled the watches together. So we never had somebody from Blue Watch and Rill stepping onto a pump with Red Watch to cover somebody. We stopped allowing that, just to try and keep as much of a bubble as possible.
Obviously, we just had some significant flooding all across South Wales areas and other areas of Wales, which had challenged resources. We'd lost 3 firefighters within the last 12 months. We were about to go into peak grass fire season as well. So probably some of the main impacts for us, fairly similar to other organisations, I would imagine. Obviously, staff numbers and keeping enough staff on shift to ensure we maintained service delivery was one of our key priorities, and ensuring that the workplace was as safe as it possibly could be. Obviously for us, one of the key implications was around some of the self-isolation provisions, particularly for our fire stations where crews obviously share an appliance altogether, so they're all in quite close proximity, and there isn't really a lot else we can do other than that. So I imagine similar to local authorities with refuse vehicles and those types of crews. PPE stocks and availability, obviously a key one early on in the pandemic, being able to source the correct type of PPE, establishing what the correct type of PPE was, and availability, because understandably a lot was being diverted straight through to the NHS. We were also dealing with quite a lot of requests from our partners, so it was working with those partners and our staff, and particularly our trade unions, to ensure that we could maintain our service delivery but also assist those partners. The usual one, ICT demands for agile working and availability of resources, and the capacity of our ICT department to enable that to happen, certainly focusing on the key areas first. As a uniform service, we've got fairly good structures in place to deal with that. So we set up a critical incident team immediately. So that comprised the senior managers from across the organisation. So no area of the service was unrepresented. And we set some very clear objectives and deliverables for that critical incident team to achieve and work to. Meeting frequency varied. Sometimes it was meeting 3-4 times a week when there was lots going on, particularly in the early phases when a lot was changing quite rapidly. And then we were able to reduce the frequency when we went through periods of greater stability. Those meetings were a good focal point for the Local Resilience Forum, Welsh Government feedback, for looking at the strategic risk of COVID and the mitigation measures that we were putting in place, and also bringing together a lot of the national sector specific guidance that was coming out through our National Fire Chiefs Council. It was also the place where we monitored the PPE availability, the stocks. We had our occupational health involved in the critical incident team, so they gave very sector specific advice on things such as PPE, some of the key risks that we as a sector would be facing. And it was also our avenue for getting out regular comms to the organisation. So we put our comms out at a set time during the week so that staff knew when they could expect the updates coming through from the critical incident team. I think the other bit we did to ensure that we could make informed evidence-based decisions, we quickly set about tasking staff to create some key data sets that we'd need access to assist our decision making as we move through the journey of the pandemic.
You know, certainly for the reduction in number of staff, we got well practiced and well versed that, you know, whether they sit back from a loss of staff due to industrial action, to a loss of staff due to illness, to the pandemic. So, you know, our business continuity plans, and I'm quite proud of the fact that we do have them for all sort of eventualities. You know, but I will say that, you know, I think everybody said they had a business continuity plan for the pandemic. Without doubt, ours is now better than it was. It did what it needed to do at the time, but we've learned from this. We've learned that, you know, that one of the things that we might get is it's not necessarily us losing staff, it's our staff, family not being able to work, or children being affected, or and that side of things, which, you know, we perhaps didn't consider as much and didn't think it might be one of the higher risks. But clearly, you know, our staff, firefighters particularly, whose partners work in the health sector, there was always that risk. And, you know, we did have, you know, I think in the very early days, the first 6 or 9 months, every single individual who tested positive from our staff had a partner who initially had symptoms and worked for the health sector. So, you know, our business continuity plans have evolved and have improved. So, you know, our stations are much more COVID safe than they ever used to be. I don't think it's been massively impacted. We look at the number of homes safe and well checked, the percentage of safe and well checks which we've carried out after being referred by a partner agency are still up at 35%, which is over the 30% target. So I think we've been able to continue with those partnerships which we've had and which were well established. One thing which I think has really come to light is we're fully involved in the strategic coordination group. So in peacetime, if you like, we have the local resilience forum where I'm the deputy chair, assistant chief constable is the chair, and basically all the identified risks in North Wales we plan and exercise against to ensure that we're ready. Once again, you know, we've done pandemic planning, we've done pandemic exercising, but as an SCG, the partnership, and I think the partnership has grown stronger. I think that senior leaders from all the public sector, or all the category 1 responders in North Wales, the working relationship between them has improved massively, because, you know, we are still, you know, I'm twice a week I'm meeting with the full SCG. You know, we did have a phase where we started some recovery group, and that was after the summer and before the lockdown started again, when we reinvigorated the gold meetings, the SCG, the strategic coordination group. But I think those partnerships have developed tenfold and are really strong. You know, we've got some really positive relationships between key leaders and senior leaders of all the public sector in North Wales, and that can only be good in peacetime. That can only enhance the way that we as public sector deliver services to the public of North Wales. Because the bottom line is, although we're there to put fires out and stop fires happening, if we can support the Welsh Ambulance Service, or if we can support social services, or if we can support National Resources Wales, then surely that should be something which we've got, you know, we will do. And I think that the development, the partnerships that have were there before but have been, I think, enhanced and strengthened, will stand North Wales in great stead in the future.
We saw an increase, particularly early on, in the number of refuse fires. I think probably linked to the local authority changes in refuse collections and the civic community sites being closed or requiring bookings. So refuse fires were a particular issue early on. We also saw a rise in cooking fires with people at home all day, so more cooking being undertaken. Big increase in our number of incidents we attended where we assisted the police or ambulance service, so 55% increase there in the incidents we attended. Similarly, a 30% increase in the assistance we provided to other agencies, and a slight reduction in the number of RTCs that we attended. Obviously, people weren't out and about travelling so much during the periods of lockdown, so we did see a reduction in those. But then I think there's been some less positive societal factors that we've also seen as a consequence. So obviously attendance at bariatric patients, we've seen a 79% increase in those, possibly associated with the risk factors of COVID. And also attendance at suicides or attempted suicides, where we've been able to assist, an 87% increase in those incidents. But then turning back to some of the more positives, during that time as well, we've been able to undertake nearly 5,000 modified home safety checks for those at risk within the communities via different methods. We've also managed to deliver some of the youth intervention work that we would normally carry out just in a modified way to ensure COVID compliance. So hopefully the public have been able to continue to receive the services that they normally would, just perhaps in a slightly modified way.
We used to go into 20,000 people's houses to do home safety checks, safe and well checks. We made the decision very early on. We stopped that face-to-face contact. That's too much of a risk, one, to our staff, and two, to the communities. You know, when I say one and two, I'm not saying that in any order, but you know, for those two reasons. And we carried out telephone audits. And if somebody didn't have a detector, either logistics delivered one or we posted one with instructions on how to fit. So, you know, without doubt, that's one of the learning points that we'll take forward, because why would we drive, you know, 40 minutes to, you know, somebody's house to fit a smoke detector when they're, you know, generally safe? They perhaps just need a bit of, you know, reminding of some of the fire safety rules. You can do that on the telephone as opposed to somebody actually visiting it. So I think there's a real opportunity for us to take some of the things that we've done. So I will say, you know, safe and well checks, we'll be re-looking at that strategy. The provision of the logistics cell, because previously each department had their own driver, or had, you know, not necessarily a named driver, but, you know, stores department would be delivering things in a van, fleet department would be delivering things, operations would be taking it operational equipment. Having a logistics cell now is we can be much more efficient in how we do that. So, you know, the impact on the environment, the impact on our fuel bill, the impact on road risk and the reduction in road risk are things which, without doubt, we can take forward and improve what we previously did. You know, we've really tightened up on our decision logs. So, you know, what we said very early on was we need to record the decisions why we're doing things, and this is custom and practice in the fire gold situation. So when we have a large event, a large incident, and I make a decision as a gold commander, I put my rationale for that decision, and I also put, you know, what things I decided not to do and the rationale for not doing them. We've managed to say, well, actually, you know, we broaden that into the whole response to this. So our gold meetings now, so when we make a decision, we say, right, and let's say we're going to stop drill nights, for instance. We put down, you know, stopping drill nights. Why? To keep staff safe. What are the risks? What are the mitigation? You know, consider keeping them open. Why would we do that? What are the risks? What's the mitigation? And then the final column would be, you know, we decided not to do this because X, Y, and Z. So, you know, I think we've got a lot better, a lot slicker about recording why we do things and justifying why we do things. And you know, one of the biggest learning things I think we've also is that we need to get our communication all through the organisation, because everybody on the fire station knew what they had to do, but they didn't necessarily know why they had to do it. And you know, I think that any debrief you have or any sort of evaluation of something, one of the things that always comes up is communication could be improved. So we're not surprised by that, but you know, it's given us real impetus to put, you know, better communication channels and more direct communication channels in place.
The immediate availability of accurate data sets was challenging to start with, particularly around not only normal staff absence for our ordinary sickness, which we are used to recording, but obviously staff absence for COVID, which we recorded separately, and also staff absence for periods of self-isolation. And we needed to work up data sets where we actually predicted return dates from self-isolation or COVID, so that we could work out the potential shift implications going forward. And we had data sets working that out across the board. And that was particularly key for us because obviously with crews sharing an appliance, there was a risk that we could lose whole crews at a time if self-isolation kicked in. We also needed some pretty accurate data on our level of PPE stocks and the availability and orders that we had in and when their predicted arrival dates were. So we had some good data sets developed for PPE levels on all of our stations and at our key other sites, training centre and headquarters, and merged those with the order and arrival times of new PPE stocks to ensure that we kept our crews as safe as we could with all the PPE that they required.
We also stopped our RDS drill nights. So to stop individuals coming in from the communities into a fire station for 3 hours, we made a decision that we were able to stop it safely for a period of time where there would be very little skill degradation. So we were able to stop them coming in and only actually respond when there was an emergency fire call to minimize the amount of transmission we had. And, you know, we've been extremely lucky. And well, it's not just luck, it's, you know, because of a lot of the measures we put in, that we haven't had, you know, lots and lots of staff off at the same time with the virus. We have had an episode about a month ago where we had a cluster of 2 or 3 people positive at one station, which resulted in the whole watch being self-isolated. But, you know, we have business continuity plans, and we've had for years, where we can look at loss of staff. So
we also had to maintain our safety critical training during this period of time so that we ensured that our firefighters maintained competency and were safe in discharging their role, and ensuring that we had enough staff who were competent to fulfil the shifts that we needed to have in place to deliver our service to the public. And set against that, obviously, the normal retirement profile that we were facing. We did have to look at that and approach some of the people who were about to retire, whether they would be prepared to stay on for a limited period of time. But because we tend to recruit in batches, we tend to lose in batches as well. So we were finding that our retirement profile was actually increasing. So we also had to then work out how to run a whole-time recruitment campaign and run whole-time courses for new firefighters in a COVID compliant way, which obviously meant that we could have significantly less on each course. So the resource requirement for those to ensure that we had enough crews on stations was quite a challenge.
I know that we won't be going back to how we used to do things. I think the legacy will be that we can, you know, and the authority will be able to certainly take the lessons learned and about the efficiencies we've made and how those can be improved will change the way we deliver some of the things that we do. I think it'll also mean that, you know, we'll look at the way we work, and instead of having 40 people driving into St Asaph from all over North Wales 5 days a week will be a thing of the past. So, you know, the environmental aspect of it will, you know, will be reduced massively. Our fuel bills will be reduced massively. The way we carried out our other business. And an example, I live on Anglesey, I drive into St Asaph, and then I might drive to Wrexham for a meeting in the afternoon, then drive back to St Asaph. You know, I would probably spend 4 hours on the road, which can be, you know, far better. You know, although you know, you work in far more, you're actually not tired for driving, you're not, and making unnecessary journeys, you're not creating that additional road risk, you're not creating all the environmental impacts that you're driving 30,000 miles a year do. So you're able to have meetings. I go to Cardiff twice a month. I go to London on the train once a month, once every 2 months, to different meetings, national meetings. Without doubt, this is, although we did have the facility for video conferencing and we used it, we'll be using it all the time now. So the legacy will be a much leaner fuel bill, a much more environmentally friendly service, where we'll embrace all the technology that's allowed us to work.
I think we also want to try and harness those more agile ways of working. They have been accelerated during COVID, probably far quicker than we would ever have done them otherwise. There's been a far greater engagement and embracing of the digital technology and the learning across the organisation. So we do want to try and harness that going forward. It also means that we can deliver our services in a much more environmentally friendly way as well, by reducing the reliance on people driving around South Wales, printing copies of things off, bringing people all together in one site. So we don't want to revert back to the old ways of working in some of those key areas. Yeah, I think for me, one of the biggest reinforcements that occurred through COVID is that our staff really are amazing, and they want to do their best, they want to step up to the mark, they want to deliver that service for the public. And I think COVID has helped them all understand how they fit together in that chain. So, for example, procurement and stores understand how them getting PPE in and getting it delivered out to stations enables them to go and do their work. But I think as well, the way that staff stepped up and cared for each other's welfare during the period, we noticed there was a drop in our ordinary sickness, non-COVID sickness. Our on-call availability increased during that period by our on-call members of staff who perhaps were being furloughed from their full-time employment, but were happy to put the extra hours in for us as a service. And just the way that different groups of staff all worked together to ensure that we delivered our service. Staff were redeployed, staff stepped up and assisted other departments where they needed it and where the pressures were. So all undertaking different roles, but working towards one common goal at the end of it.
I suppose the bottom line is just how absolutely proud I am of the way that every single person in this organisation has pulled together to go, push and make sure that our strategic intent was met, which was keeping staff safe and continue to deliver the operational and the preventative response. And every single member of staff, regardless of what role they play in the organisation, has ensured that the service and the authority have been able to keep to that strategic intent, and I'm just extremely proud of them all.